that was a long way of saying I'm mindful that I need to take care of myself, and I'm worried about you guys, and I'm worried about everybody that I know. I want everyone to come out of this on the other side healthier, stronger, wiser. Thanks for clicking on Simply Tanika. I am Tanika. If you are new here, welcome. Hit that subscribe button. Let's hang out a while. If you are returning, welcome back. What's up, fertility fam? We gotta do what? Let's get those babies, ladies. Drops fall and the beauty of it all. What's up, fertility fam? Today is Wednesday. It is the 25th of March. Happy hump day to ya. Happy hump day to ya. Happy hump day. All right, it's chemo day. Wednesdays are chemo day. So mom has already gotten up. She's made chorizo with potatoes, beef chorizo, some bacon. I think there's peppers in there. I haven't had my burrito yet, but I'm gonna have that. And then she also started some short ribs for tonight. So she's managing her energy. She wants to get all this food done, and then it'll be ready for later. And when she's done with chemo, she can rest. But that's kind of what's it. We got the news yesterday that they are not allowing visitors in for chemo. And I get it. You know, it's better for the patients. It's better for everybody. The patients are obviously immunocompromised. So my sister went in for the blood work, and that's when they told them. But then mom said, well, she's my care provider. So they hesitated, and then they let her in. So I think sister's going to go with her today, see if they will let her in, because she's got to do the ice packs, or the nurses will have to do that. So it's the 2 ice packs on each foot for an hour, and then switch them out. And then we're doing water bottles today instead of the gloves. We had a little mishap with the gloves last night. We were trying to thin them out, and in order to get it in the thumb, I had to put a bottle on top of it, the ice bottle, in the freezer to try to get the water in there, because last time it was too bulky in the palm, where the way the ice formed, but I had to put a lot of water to get it to push to the thumb. Anyway, someone went in the freezer, moved the bottle, so they are kind of like this. Those are not gonna work. So we're gonna use water bottles, and hopefully that works, and she can just hold those in her hand. So, all right, I'll show you a little bit of the breakfast, and then I gotta put lidocaine on mom on her port so it doesn't hurt, or hurts less when they inject her. It's actually on this side. But yeah, and then we'll get going. So stay tuned. So here is the chorizo that she made. And there are the burritos with the tortillas and all the dishes. Here comes sister. I think she was mocking me, y'all. That's not her normal voice. All right, here we go. Let's go. Mom's in the shower, so I'm just gonna show you. We got the, if I can get in here. I just left it on the tripod. Yellow stripes. So those are the meds she needs to take before we go, and then that is the Tegaderm, and the lidocaine. So it's the same concept of, I'm in the dark. It's the same concept of when we all use lidocaine before our injections, except hers is a port, so it's more than a needle. It's a little bit bigger. It's an infusion similar to like the infusions that I get voluntarily in my arm, except because the chemo is killing the cells, you can't continue to do it in the arm because it'll kill the blood vessel cells. So anyway, there's a port, and so it hurts her. There she goes. There's not a lot of muscle and fat because she's so tiny, so it's more sensitive than, I mean, I'm sure it's sensitive for everyone, but other people have like extra padding, and they're like right on her. So there, let's see what Erica has to say to y'all.
Hey y'all, hey fertility fan.
Is that your voice? Or are you making fun of me?
I'm mocking you, maybe.
Maybe, okay.
Don't get too close.
Wait, tell them what's up.
Yeah.
Oh my God.
Go away.
All right, I got a text from sister. They did finally let her in. Whoa. They did finally let her into the infusion. At first, they were not going to let her in. And then she was like, can they come get the ice packs at least? And then they let her in. So we'll see. They should be home shortly. I'm gonna eat my burrito. It's almost, well, it's like 2:15, I guess. It's almost 2:30, so they should be back. And then I think I'll make cookies. Mom's making short ribs. I'll make cookies. Her weight is up a little bit. They sent me a text, but she's still under 90 pounds. So if we can get her up to 90, I'll feel good. But we're trying. I'm just glad it went up and not down. So progress, not perfection, right?
Hey, girl.
What's going on?
Hey, Fam.
I also got on a new outfit today. Wait, look, guys. See that? Neep. She let her mom come over here. Didn't you? Uh-oh. No, lay with mommy. Okay. Hey, guys. All right. It's 9:33. I'm having some tea. My throat still hurts. Yeah. We didn't eat. Mom is knocked out. I went in there to give her meds at 9 o'clock, and she wanted to take them at 9:45. So I'll go back in there in 15 minutes, and then her last dose is at 11:30, and then I'm gonna zonk out. But she was tired, so she made the short ribs. She put them in the crock pot this morning when she did the chorizo, and then she was gonna do cabbage, but she's tired. And sister and I are not really hungry. We did ants on the log, or there were no ants. I made peanut butter celery sticks for us to have, so we ate that, and then I'm gonna do a thing of bone broth. I have I have the bone broth I got yesterday, but I also have it in the pack. I think I'll use the one in the fridge. It's fresh. I'm gonna do a cup of bone broth just so I keep my immune system strong. And yeah, today I feel like every week, Wednesday, chemo is a little stressful for all of us. There's the anxiety of getting out of the door. There's extra meds she has to take on that day. Some of them 2 hours before, and then 1 hour before the treatment, then starting her lidocaine an hour before. She did it herself today, but she did a lot of it and used the Tegaterm. She didn't wait for me, little Miss Independent. And she said it was not painful, and she had a different nurse. It was a lighter touch, and Mom mentioned that she talked to the nurse about the one she had last week, and she said, yeah, that one is known for having a heavy hand. Most people don't see her a second time by request. And yeah, Mom was up a little bit in weight, which is good. She's still under 90 pounds, but I'll take it. Up is good. I think that impacts it too, when someone's like leaning over you and you're already tiny. I mean, she's always tiny. It's not like she's frail. She's just tinier than normal. But that also makes me more protective of her. Like, I want to make sure they're taking care of her and not, I don't know. So I think, yeah, we run around on this day to make sure she's comfortable. We did the water bottles, which she likes, so it sounds like we're not going to try the gloves again for her neuropathy. Sister recommended that she use them in the car, which I think is a good idea, because it's supposed to be 15 minutes before and 15 minutes after the Taxol, or 15 minutes before all throughout and then 15 minutes after, but she'll hold it, whatever it is, and then let it go so she can read her book. But if we start her earlier, they'll already be cold when she gets there. So we'll try that next week. They did let sister in. Apparently, if you're a care provider, you can come in versus like a visitor. And because Mom is like questionably independent, they let her in, but only one person. So I'll probably go next week, assuming that my throat is fine and I don't, obviously I don't feel sick. Not because I think that I've got COVID. We've already claimed that I don't, but just because my immune system is a little suppressed, and it won't help if I'm knocked out. Like, there's really no way to isolate me in here, and then that just puts more burden on Erica, because then she'd be doing all the meds for Mom. So we're all trying to stay healthy, and so yeah, that'll be good. And then in fact, Erica said she didn't stay in the whole time. Like, she put the ice packs on her feet and then she left. She was like, it was eerily quiet and lonely, because normally they allow you to have one visitor. Like, everybody would have one visitor. So she said there were no visitors and there were less people, so they might be trying to enforce the social distancing within the treatment section. They're not, I think I showed you guys one. If not, I'll show you next week. They're kind of like the rooms if you've been to the clinic, like for IVF, like the little surgical rooms, like you have your own chair bed thingy that reclines, and then they come in and there's like a curtain that divides it but not a wall, because before we gone, I'd done some research on chemo rooms, and there was somewhere it was just like recliners like right next to each other, no curtain, no separation. So there is distance anyway, but based on what Erica was saying, it was like every other one was filled. So they're just creating more distance, which is good because the patients have to go and their immune system is suppressed. So I think everything we can do to support them will help. So yeah, that's that. But we're exhausted. I'm exhausted. I do want to say thank you to all of you guys who sent me well wishes. And yes, you were right. I had not been taking care of myself. So this week, that's what I've been focused on. If I'm not good, I can't take care of her. I can't help support my sister. So I don't want to overburden anyone, and I want to make sure mom gets what she needs. So I got to take care of myself. So I ordered the food. I've been eating better. I haven't had candy, although sister brought donuts in here, so I did have an old-fashioned covered with chocolate glaze, but baby steps. And then met with Clara yesterday, which was like a breath of fresh air.
It's nice to have this as an option to continue the dialogue.
Yeah.
People have been calling, like, can we just talk? I feel really anxious. And that's been great. It makes me happy that I can just kind of be there with you.
Yeah, I mean, it's also like your voice is very soothing, and I've already had the experience of like having hands-on with you, so it just sort of triggers all that calming and peacefulness, and like just seeing you, I'm like, the world is still safe.
That makes me so happy to hear.
It was just nice and calming hearing her voice, which was, I needed that. And then I met with Courtney to go over my nutrition. I have not kept up with my water intake, though. I did get a water bottle to help me measure, and my sister's been kind of keeping track of me, but I need to be better about the water. I can commit to the yoga, and I think walking outside, I guess, but I don't know, like 10, 15 minutes maybe. It's starting.
Every day or like every other day?
Oh my God, no, not every day. I'm so like we gotta crawl. And we only did 3 things, and then we're gonna see each other in 2 weeks. So I've got to build back up to where I was. I was on a good streak in New York, but then my world kind of got turned upside down. So yeah, and then I'm doing yoga on Friday with Barry, who I normally do at her place on the West Side. And when I'm in New York, she's gonna do like a Zoom class, and so I'm gonna do that. So I'm doing a better job of taking care of myself. I drank a whole thing of water today. I haven't gotten down to 2, so I still have time though. It's not even 9:30 quite yet. So, or is that right? I got a glare now. It's 9:39. So yeah, I still have 3 hours, and then I've got a full day of work tomorrow, which should be fun. I probably am not gonna vlog tomorrow, but I'll do it again on Friday. So you guys can see the Zoom and how that goes. And I've got Amazon stuff coming, so we'll do a little unboxing, we'll do a little yoga. Slowly but surely I'm getting the things that I need. I didn't pack enough because obviously I didn't know I was going to be here as long. And I didn't book a return ticket, so I didn't have an idea of exactly how long I would be here. Then when I got here, I thought, I'll go back the first week of April. Which would be the week after next, because I know the 1st is next week, but I'm not counting that as the first week. The first full week of April, I was going to go back at the end of that week, and now that does not seem responsible based on whatever, with COVID here in this state being on lockdown, COVID there. I was just texting with one of my fertility sisters who also works with me, and she said it's pretty scary there. People are scared, and there are, more outbreaks. Obviously I see it on TV, but I'm not there and hearing it, and obviously when it's work related you can't say the person's name, and so people are like speculating. They'll get a notice saying you came in contact with someone who tested positive, and then they're all, I don't know, it just is like, it makes it stressful because you don't know who it is, and were you really close to them, were you with them for 30 minutes, and you can't get tested unless you have come in contact. I don't know what she said, because they know the person is positive. They're telling them to watch for symptoms, but not to get tested. So I just feel like once you know that, everybody should be in quarantine. But I don't even understand how that works now that I'm thinking about it. I'll have to text her, but it's late there. It's 12:39 there in New York. But she's good. Her baby's good, and so I was happy about that. But she has a little one at home. I think he'll be 2 this year, or he may be. Anyway, he's 3 or under, and then her mom is 70, takes care of her son, so she's coming home, and it's like they've recommended when she comes home, take off all her clothes, put it in a bag, take a shower, And then you have to be careful with things like glasses, like my glasses, something could be on there. Phones, all those things, you have to keep wiping them down. So it's an exercise in diligence for sure. And then you've got the president who wants to open it up by Easter. I beg of you, my TTC sisters and anyone else who is watching this, please, please, please take care of yourself. Stay in as much as you can, as much as possible. Keep your social distancing practices 6 feet. Wash your hands religiously. Wipe down surfaces, light switches, laptops, phones, refrigerator handles, oven handles, cabinets, anything that's touched on a regular basis. Just, if you don't have like an automatic trash can, wipe the top of the trash can down. I'm just looking around. Doorknobs, anything that you're touching on a regular basis, remotes, all of those things, keep them wiped down. And take care of yourself, build up your immune system, and do all those lovely things. So that was a long way of saying I'm mindful that I need to take care of myself, and I'm worried about you guys, and I'm worried about everybody that I know. I want everyone to come out of this on the other side healthier, stronger, wiser. So I'm rooting for you, I'm praying for you, but all the prayers in the world will not help if you do not practice, good hygiene and extra heightened cleaning practices while we get through this. And we'll get through it. We'll be talking about it later and having memories similar to 9/11. It's tragic. We bond and we move on. So yeah. All right, guys, I will talk to you later. Bye. Baby, that's to us all.